First things first, there are 17,446 confirmed aggregate cases of coronavirus in Victoria. That is 216 new cases since our last update. I'm saddened to have to report that there are now 363 Victorians who have passed away because of this global pandemic. That's an increase of 12 since yesterday's update. Our thoughts and prayers and best wishes are with the families of those 12 people, and we wish them well at this very difficult time. The information I can provide you is that 3 of those 12 are males in their 70s, 4 females and 1 male in their 80s, 3 females and 1 male in their 90s. All of these deaths are linked to aged care outbreaks. There are 675 Victorians in hospital. 45 of those are receiving intensive care and 29 of those 44 are on a ventilator. A total of 2,008,630 tests have been processed, which is an increase of 16,109 tests since yesterday, and I'll return to testing in just a moment. There are 3,751 cases with an unknown source, mystery cases. It's an increase of 82 since yesterday's report. That's it, 82 closed out at the conclusion of that investigative process. There are 1,065 healthcare workers who are active cases. There are 2,050 active cases in aged care settings and 7,155 active cases across the state. Just to give you both an aged care and a disability update before I give you an update on a number of business support initiatives and partnerships that we have that we're announcing, and others that we can report progress on. In aged care, as at the 19th, total number of cases associated with aged care facility outbreaks since the 1st of January is 3,337, of which 2,050 are active cases. To give you some further breakdown of those active cases, 5 of those are in public sector aged care, and 2,045 of those are in private sector aged care. Similarly, as you would expect, in terms of outbreaks, there are 120, 6 of those outbreaks, with 2 co-located on the one premises, are in public sector aged care, and 114 of those are in private sector aged care. In disability, there are 79 active cases in those disability facility settings. That's as at the 19th, 79 cases, of which 19 are in transfer facilities, so facilities that are transitioning across to the NDIS, 60 that are actual NDIS services, and I know there was 1 in a state-run facility. There's now 0, so that means that of the 60 outbreaks, that's 79 cases. Of the 60 outbreaks, it is 19 in transfer and 41 in NDIS. Total staff cases 60, total resident cases 19, and all 19 of those are in NDIS services. I think that's probably all in relation to the kind of the virus numbers for the day, but I wanted to take you through a number of other important updates. The Upskill My Business program, which is a very important program to provide vital skills and support to small businesses in particular, around diversifying, around adapting, around building stronger on the other side of this 1 in 100 year event. That's 25,000 Victorians have accessed that program, and we're very pleased obviously to provide that support with our partners. That's a very significant take-up. There's just under 130 courses that are offered, and they cover a whole range of different elements of adapting, different elements of trying to make sure that those businesses are as strong as possible on the other side of this event. So we're very grateful to Deakin University and RMIT, who have been our principal partners in providing that support. So 25,000 Victorian users of that scheme, which I think is a very meaningful take-up. Secondly, last week we opened our $26 million Small Business Mental Health and Wellbeing program, and today we can announce that we're joining with the Victorian Chamber of Commerce and Industry, the Chamber, in launching a new business mentoring initiative as well. That's all about helping businesses to navigate the challenges, very significant challenges that this virus poses, and that'll match small business owners and sole traders with experienced professionals who can provide that mentoring support. We're very grateful to Becky, to Paul Guerra and his team for their very positive partnership, not just on this but in lots of different programs, lots of different elements of our business support package. We're very grateful for that positive partnership, and it's always best to engage in that very meaningful way to design programs that will meet the needs that are there, but also to have a willingness to adapt and change those programs as the virus adapts and changes and has different impacts today that it might have, say, 3 months ago. Now, I had committed to come back to you in relation to business support fund grants and payments to individuals. So we're now at around $1.3 billion that's been provided to more than 75,000 small business operators across the state. That's a total of $20,000 available for eligible businesses in metropolitan Melbourne and Mitchellshire, of course, noting their now historic inclusion in the then Stage 3, and $15,000 available throughout the rest of Victoria. So that is a very significant undertaking, and of course we don't rule out providing further support in the event that that is needed. In terms of test isolation payments and the isolating at home if you have in fact tested positive, so that's all about people who don't have sick leave to fall back on, those insecure worker payments for want of a different term. $450 test isolation payment has been provided to in total, 19,500 Victorians, so that's $6.5 million worth of payments that have been made. That's a very significant uptake, and I think that's directly dealt with one of the challenges in terms of people getting a test and then not potentially isolating while they wait for the test result, the notion of not being paid if they didn't work the shift. So that, I'm very pleased to see so many people accessing that payment, and I would again say to anybody who's got symptoms, please come forward and get tested. If that will mean you're out of pocket while waiting at home to get your test result, there is that now $450 payment available to you, provided you don't have sick leave to fall back on or you're not on some other payment like a JobKeeper payment, for instance. Then we will make that payment to you, and we'll do that as quickly as we possibly can. In terms of the $1,500 coronavirus worker support payment, which the Commonwealth, I'm pleased to say they've now taken over that payment. We look after a number of ineligible groups. So, for instance, those who don't have permanent residency or aren't citizens. But in broad terms, there's $10.4 million has been paid out. That's to 6,900 workers who have either tested positive for coronavirus or been in close contact, and of course had to isolate for that 14-day period, and they too don't have sick leave to fall back on. Can I thank obviously the federal government in relation to their most recent work around that payment, but can I also thank the union movement as well as businesses who have worked with us closely to design and to indeed increase those payments where that was deemed appropriate, going from $300 to $450, particularly in relation to that test isolation payment. Now, I also committed that I'd come back to you with a number of updates in relation to WorkSafe enforcement. So as you know, we've got COVID safe plans across the board, but particularly focused on a number of high-risk settings, although any workplace without proper safety can be a high risk and a really significant risk of transmission, given the wildly infectious nature of this virus. But since we announced our workplace inspection blitz on the 19th of July, WorkSafe have now visited some 724 workplaces and issued 62 notices to employers. That takes the total number of inspections since the beginning of the pandemic to some 4,911, and 168 notices in total since the pandemic began. That's across a whole range of different industries. I want to thank our WorkSafe inspectors and other authorised officers, Victoria Police, others who are involved in that work. And the clear message is to all employers, we are checking, we are monitoring to make sure that everyone's playing their part, everyone's doing as they should, to do nothing at all that might contribute to the spread of this virus, and we're grateful to the vast majority who are. But that compliance framework, those checks, are a really important way of making sure that all of those different decisions are being made in the best interests of public health, and I might say in the best interests of that business. Obviously, to have an outbreak, particularly if you might have contributed to it, that's a pretty significant issue and not good for your business. So, in general terms, though, those numbers are with 724 and only 62 notices to improve, and there'll be a range within that 62 as well. Some of those may well have been quite minor matters, others may not be, and if I can provide you with any follow-up on that over time, I'm more than happy to do that.